Hello, my name is Michael. I'll be the nurse taking care of patient KM today. We are going to be doing her cardiac assessment. So I'll just start by asking you some questions. So have you been having any chest pain?
No.
Great. Any shortness of air?
No.
Okay. Any trouble sleeping at night?
No.
Okay. How many pillows do you use?
Just one.
Just one. Okay. Have you had to use any extra pillows or anything?
No.
Okay. Any cough?
No.
Okay. Have you been fatigued during the day?
I work night shift, so just the switching back and forth from day to night. Sometimes I'm kind of tired, but other than that, no.
Okay. How many hours of sleep do you get a night?
Maybe like 5 to 6.
Okay. Is that pretty normal for you?
It is, yeah.
Okay. Yeah, 5 doesn't sound like a lot, but if that's pretty normal for what you do, then okay. Have you been noticing any skin color changes, any paleness?
No.
Bluish paleness color in your skin? Okay. Any swelling?
No.
In your arms and legs anywhere? Okay. Have you been getting up in the middle of the night to urinate?
No, not
that you've
usually.
noticed? Okay. Any past cardiac history?
I did have kind of an event when I was pregnant with my first child. It would have been 7 years ago. I went through like a moment of like SVT where I was at work and my heart rate got really high, so I went down to the ER. And they didn't have to give me any medicine to bring it back down. It came back down on its own, but my troponin was bumped at that point, so they did have me stay overnight. But in follow-up and everything came out fine.
Okay, so you went into SVT. Troponin was a little bumped. They didn't have to give you any medicine. You stayed overnight, but everything was fine with that. You're not on any medicine since then or anything. Well, that must have been really scary to have to go through all that. I'm glad everything's okay. And so, all right. Did you have any chest pain with that?
Yeah, I did have some chest pain when I had that elevated heart rate.
Okay. So that was your first pregnancy. Did you have anything like that with your second pregnancy?
Not really. I think I just ran a little bit higher, but I didn't have any like events like that.
Okay. Do you know about what you ran? Like
I was probably like normally I do run higher. I run probably like 80s to 90s.
Okay.
But during pregnancy, it generally is around 90s to low 100s. Just at rest, even.
Okay. All right. Do you have any family cardiac history?
Yeah, my mom, she had coronary artery disease several years back. She had like early symptoms of a heart attack. They did a heart cath and she had several blockages that they did have to stent. She's on medication to help maintain like her cholesterol, and she has a high blood pressure that they've also been kind of working through changing medicines over the last few months to try to resolve and manage that for her. Also, my maternal grandpa had a couple of heart attacks and high cholesterol and hypertension. And then I think my paternal grandpa has had like hypertension and high cholesterol as well, but no heart attacks.
Okay. All right. And then how would you describe your diet?
I'd say like over the last year, it hasn't been very well. It's kind of been more processed foods, like more salty, fatty foods that have kind of crept its way back into my diet. But I am currently trying to do better, eating more fruits and vegetables, less fatty foods, less processed foods, and trying to steer clear of like sodas and drinking more water.
Okay. So increasing more fruits and vegetables, drinking more water, that's great.
Yeah.
That's awesome. Okay, and then any history of smoking?
No, I tried like once when I was in high school, probably 15 years ago, but other than that, no.
Okay. Well, it's good that you don't smoke. Smoking can lead to lung cancer, emphysema, so smoking's really bad for you, so that's great that you don't. And then, do you use any other tobacco products? Do you vape?
No.
Okay. Great. Alcohol use?
Rare, maybe like once to twice a month.
Okay, and then how much in a setting?
1 to 2 drinks.
Okay. right. Do you exercise?
Yes.
Okay, and then how often?
I'd say 5 to 6 days a week, 30 to 45 minutes.
Okay. And then how would you describe your exercise?
I do usually 3 strength training days and then a couple of cardio days.
Okay, very good. And then do you use street drugs or have any history of street drugs? Okay. All right, so have you been having any leg pain or cramps?
No.
Okay. Have you been noticing any skin changes on your arms or legs?
No.
Okay. Any swelling in your arms or legs? I know we kind of mentioned that earlier, but okay. Any lymph node enlargement?
No.
Okay. Are you on any medications?
I'm just taking a multivitamin and then vitamin D. About 2,000 units of the vitamin D.
Okay. Was your vitamin D low?
It was on the borderline, the low end of normal, so my doctor just had me put me on that.
Okay. Yeah, it's hard to get enough vitamin D in the winter months, especially not outside as much, not as much sun exposure. So, all right. Well, I will have you go ahead and get situated here. I'll have you lay down, and we'll go ahead and get started on the assessment. So the first thing I'm gonna do, I'm gonna palpate your carotid artery here. Okay. So that is equal on both sides, 2 plus. Okay, I'm also going to auscultate your carotid artery. Okay, I did not hear any bruits, so that's great. I would also at this time inspect for any jugular venous distension. I don't see any, so that's good. Next, I'm going to inspect your anterior chest. It is equal, and I don't see any abnormalities with that. Skin color is pink, appropriate for ethnicity. And then, so next, I'm going to go ahead and palpate your apical pulse. I'm just going to feel down here. Okay, so next I'm just going to palpate around your pericardium and note any thrills. Okay, I didn't feel any thrills, so that's all normal. Next, I'm going to go ahead and listen to your heart sounds. Okay, so I'm listening to your aortic valve area. Your pulmonic valve area. Tricuspid valve area. And then the mitral valve area. Okay, S1, S2, I don't hear any extra heart sounds, so that's great. Next, I'm going to go ahead and look at your arms. So I'm going to inspect and palpate your arms. They're warm, they're pink, there's no sores or lesions. and they're symmetrical. I'm going to go ahead and palpate your radial artery. Okay, that's 2+ on both. Then I'll go ahead and palpate your brachial artery. Okay, that's 2+, that feels good. And then I'll feel your elbows here for any enlarged lymph nodes. Okay, I don't feel anything out of the ordinary there. I'll go ahead and look at your fingernails here. So capillary refill is less than 3 seconds. And then I'll go ahead and do an Allen's test on you. So I'll have you hold your hand out like that. Make a fist a couple times. Okay, that's good. Okay, and that returned back to pink right away, so that looks great. Next, I'm gonna go ahead and look at your legs. So I don't know any swelling on either leg. Hair distribution is even. Go ahead and pull your feet back towards you. Okay, was there any pain, soreness with that? Okay, so negative, Hohmann's sign, so that's great. The skin's warm bilaterally, and there's no swelling or edema. So I'm going to go ahead and palpate your pedal pulses. Okay, so those are equal, and they are a 2+. Okay, your tibial pulses. Okay, those are 2+. And then I'll just feel behind your knees the popliteal pulses. Okay, and then those are 2+. So everything looks great. Do you have any questions or concerns today?
No.
Okay, so then that will conclude our cardiac assessment.